Are medications like Zepbound or Ozempic causing you to feel a little woozy? We're going to get into why this happens to people on GLP-1 medications, and we're also going to talk about some of the things that people who are on these medications are doing to help alleviate some of those symptoms. If you don't know me, I'm Dave Knapp, man on the Mounjaro. That's why I'm here. I'm not a medical professional. I'm not a medical advisor. This is not medical advice. This is simply me sharing my experience as somebody who's used these medications, also as someone who interacts with thousands of other people on a daily basis that also use these medications. And I'm here to tell you that nausea is one of the number one complaints that people have especially when first starting a GLP-1 or escalating their dose, whether you're on Tirzepatide, Zepbound, Mounjaro, or semaglutide, Ozempic, or Wegovy, across the class of medications. This is actually a very common side effect. And let's talk about a couple of the reasons why. Well, first of all, one of the main reasons that people experience nausea is that they're just consuming fewer calories. Your body is not used to operating on such a low amount of calories. So one of the things that we're going to make sure that we're doing is prioritizing our protein intake when we are able to get those calories in for just the sake of digestion, keeping things going and keeping your body properly energized. That's going to be a really big help. One of the other things is your gut motility has been slowed down. So the secretion of enzymes to break down foods, kind of like your body's adjusting to a new normal, right? And that's why oftentimes, even as you escalate the dose, you experience these same things because your body's getting used to that added reduction in your gut motility. Some of the other causes can be just simple things like dehydration. So you want to make sure that you're keeping up on your water, right? It's when it's hard to eat, it's also hard to drink for a lot of people. So make sure that you're prioritizing that water intake, but make sure also that you're not overdoing it on the water, because if you overdo it on the water, you're flushing a lot of electrolytes like potassium, magnesium, and sodium. You're flushing those all out of your body. So that can sometimes lead to fatigue as well. So oftentimes some additional supplementation with some electrolytes is often helpful as well. But some of the weirder things, some of the more obscure things that I would have never thought about that many people in the community do when suffering from the side effect of nausea on a GLP-1 medication. The first one is smelling an alcohol wipe. Oddly enough, this is a trick that they've been doing in emergency rooms for years and years and years. Simply smelling an alcohol wipe might be enough to, believe it or not, kind of wipe away some of that nausea. Ginger chews are another one that people often say chewing on a ginger chew is something that helps them to relieve some of that nausea. Peppermint tea is something that people have mentioned helps them as well. But above all else, even if you're not taking any supplementation, which of course consult a physician before you take any sort of supplementation, making sure that you're eating small and frequent meals can kind of help with this. And so you're not eating all your calories at once, just kind of small and infrequent meals can help. And then staying hydrated. Those are two really natural things where you're not really taking anything extra. You're just being more mindful about your water intake, your liquid intake, as well as the way that you're eating your meals. One of the things that you may want to do, if this is a troublesome side effect, if it's just none of these things that we talked about have helped, maybe you've tried all of them, it is potentially a good idea to talk to your doctor about a potential prescription for an antiemetic medication. These are medications that have been around to help people who are nauseous to keep from vomiting and things like that. So Zofran is a really common one that I hear from people around the community that their doctor prescribes for them. So if it becomes kind of a troublesome or annoying side effect that you just can't deal with, make sure you talk to your doctor. There are options out there medically that you can seek to resolve the issue of nausea. If you enjoyed this video, hit that like, hit that bell, hit that sub. We do tons of content on this channel, including a weekly show called On the Pen Live, a weekly podcast called The Weekly Dose, and we just have a ton of fun in our community here. So subscribe and join the community over here. We'd love to have you. Also check out the playlist where I have other side effects commonly complained about on GLP-1 medications, and you can kind of find out a little bit more information on those other side effects as well. But until next time, we'll see you on the pen.